Question 1. A client with sickle cell crisis is admitted. Which intervention should the nurse prioritize? A. Provide high-protein snacks. B. Encourage ambulation every hour. C. Administer for hydration as ordered. D. Place the patient in Trendelenburg position. Answer. C. Administer for hydration as ordered. Question 2. Which client should the nurse assess first during morning rounds? A. A client with iron deficiency anemia reporting mild fatigue. B. A client with thrombocytopenia and petechiae on the chest. C. A client with polycythemia complaining of headache. D. A client with hemophilia requesting education on self-injection. Answer. B. A client with thrombocytopenia and petechiae on the chest. Question 3. Which task is appropriate for the nurse to delegate to an experienced UAP? A. Educating a client on warfarin therapy. B. Administering subcutaneous heparin. C. Obtaining vital signs from a post-transfusion patient. D. Assessing for signs of bleeding. Answer. C. Obtaining vital signs from a post-transfusion patient. Question 4. A nurse receives 4 hematology patients. Which one is the priority to assess? A. A client with leukemia who has a WBC count of 4,000/mm superscript 3. B. A client with a new onset of confusion and low hemoglobin. C. A client with sickle cell anemia requesting a warm blanket. D. A client with iron deficiency anemia asking for a snack. Answer. B. A client with a new onset of confusion and low hemoglobin. Question 5. Which patient finding is most concerning for a nurse caring for a patient with DIC? A. Bruising on the arms. B. Pink-tinged urine. C. Oozing from 4 sites. D. Low platelet count. Answer. C. Oozing from 4 sites. Question 6. A nurse assigns a patient with neutropenia to a semi-private room. What action requires follow-up? A. The roommate has no known infection. B. Fresh flowers are placed near the bed. C. The client is instructed to avoid crowds. D. Visitors are screened for signs of illness. Answer. B. Fresh flowers are placed near the bed. Question 7. A nurse is caring for a client with aplastic anemia. Which action should be questioned? A. Monitoring for signs of infection. B. Administering IM injections routinely. C. Encouraging frequent hand washing. D. Using electric razors for grooming. Answer. B. Administering IM injections routinely. Question 8. Which action by a nurse best ensures safe care for a client receiving chemotherapy with severe neutropenia? A. Giving the client a daily multivitamin. B. Checking the temperature every 8 hours. C. Placing the client in protective isolation. D. Allowing family to bring home-cooked food. Answer. C. Placing the client in protective isolation. Question 9. The nurse is planning care for a client with hemophilia. What is the highest priority? A. Preventing dehydration. B. Preventing infection. C. Preventing bleeding. D. Preventing hypoglycemia. Answer. C. Preventing bleeding. Question 10. What is the most appropriate nursing action for a patient with thrombocytopenia and platelet count of 20,000/mm superscript 3? A. Encourage active range of motion. B. Apply firm pressure after injections. C. Administer aspirin for pain. D. Insert a rectal suppository. Answer. B. Apply firm pressure after injections. Question 11. Which of the following tasks is safe to assign to an LPN? A. Initiating a blood transfusion. B. Monitoring for transfusion reaction. C. Teaching signs of internal bleeding. D. Assessing neurological status. Answer. B. Monitoring for transfusion reaction. Question 12. A client on warfarin presents with an INR of 5.2. What is the nurse's priority action? A. Recheck the INR in 1 hour. B. Prepare to administer vitamin K. C. Increase green leafy vegetables. D. Continue warfarin as scheduled. Answer. B. Prepare to administer vitamin K. Question 13. Which client should the nurse see first? A. A client with leukemia and a fever of 101 degrees Fahrenheit. B. A client with iron deficiency, anemia, requesting a dietary plan. C. A client post-splenectomy with pain rating 6 out of 10. D. A client receiving epoetin, reporting mild headache. Answer. A. A client with leukemia and a fever of 101 degrees Fahrenheit. Question 14. The UAP reports that a post-transfusion client is shivering. What is the nurse's best initial response? A. Notify the provider. B. Reassess the vital signs. C. Increase the 4 fluid rate. D. Give acetaminophen. Answer. B. Reassess the vital signs. Question 15. Which of the following indicates effective delegation by the RN to a UAP for a client with anemia? A. UAP assesses skin for pallor. B. UAP checks oxygen saturation. C. UAP explains iron-rich diet. D. UAP reports patient fatigue. Answer. D. UAP reports patient fatigue. Question 16. A nurse caring for a client with multiple myeloma should prioritize which intervention? A. Ambulate frequently to prevent DVT. B. Encourage high dairy intake. C. Restrict fluids to prevent overload. D. Monitor for bone pain and hypercalcemia. Answer. D. Monitor for bone pain and hypercalcemia. Question 17. What finding in a patient with polycythemia vera requires immediate attention? A. Hematocrit of 55%. B. Complaints of leg swelling and pain. C. Report of fatigue and blurred vision. D. WBC count of 12,000/mm superscript 3. Answer. B. Complaints of leg swelling and pain. Question 18. Which task is best for the RN to delegate to the UAP caring for a client post-bone marrow biopsy? A. Monitor for signs of infection. B. Teach how to care for the biopsy site. C. Apply pressure to the site as directed. D. Assess for active bleeding. Answer. C. Apply pressure to the site as directed. Question 19. The nurse prepares to give a blood transfusion. Which verification step is most critical for patient safety? A. Confirm the client's room number. B. Check blood type against the prescription. C. Check the expiration date of the blood. D. Ask the client for allergies. Answer. B. Check blood type against the prescription. Question 20. A nurse is caring for a patient on heparin therapy. Which finding requires immediate intervention? A. Hematuria. B. Mild bruising at the injection site. C. Occasional nosebleeds. D. Redness around site. Answer. A. Hematuria. Question 21. A client with heparin-induced thrombocytopenia, HIT, is admitted. What is the nurse's priority? A. Prepare for platelet transfusion. B. Stop all forms of heparin. C. Initiate high-dose aspirin. D. Place patient in reverse isolation. Answer. B. Stop all forms of heparin. Question 22. Which dietary selection is most appropriate for a client with iron deficiency anemia? A. Grilled chicken and mashed potatoes. B. Baked salmon with white rice. C. Liver and spinach salad with orange slices. D. Yogurt with granola and berries. Answer. C. Liver and spinach salad with orange slices. Question 23. A client on chemotherapy has a WBC count of 2000/mm superscript 3. What is the best nursing intervention? A. Limit visitors to 2 per day. B. Place in a private room with neutropenic precautions. C. Encourage high-protein, high-calorie meals. D. Monitor for bruising and petechiae. Answer: B. Place in a private room with neutropenic precautions. Question 24. Which of the following actions by the nurse helps reduce risk of bleeding in a patient with thrombocytopenia? A. Encourage use of hard-bristled toothbrush. B. Administer intramuscular injections. C. Avoid rectal temperature measurements. D. Provide aspirin for pain relief. Answer: C. Avoid rectal temperature measurements. Question 25. What is the most important teaching for a client being discharged on warfarin therapy? A. Avoid eating chicken. B. Use a soft toothbrush and electric razor. C. Increase intake of leafy greens. D. Take aspirin for headaches. Answer: B. Use a soft toothbrush and electric razor. Question 26. Which patient would be most appropriate to assign to the LPN? A. A newly admitted client with suspected DIC. B. A client 1 day post-bone marrow biopsy needing wound care. C. A client receiving chemotherapy for acute leukemia. D. A client with a suspected transfusion reaction. Answer: B. A client 1 day post-bone marrow biopsy needing wound care. Question 27. What finding in a post-transfusion client suggests a delayed hemolytic reaction? A. Hypotension and back pain within 15 minutes. B. Jaundice and dark urine a week later. C. Shortness of breath and fever within an hour. D. Urticaria and itching during the infusion. Answer: B. Jaundice and dark urine a week later. Question 28. What is the most important assessment before administering packed red blood cells, PRBCs? A. Blood glucose. B. Bowel sounds. C. Blood type and cross-match. D. Intake and output. Answer: C. Blood type and cross-match. Question 29. A nurse notices chills and fever in a patient receiving a blood transfusion. What is the nurse's first action? A. Administer acetaminophen. B. Stop the transfusion immediately. C. Increase the transfusion rate. D. Notify the provider after completion. Answer: B. Stop the transfusion immediately. Question 30. Which client requires the most immediate attention? A. A client with sickle cell disease requesting pain medication. B. A client with hemophilia who bumped their head. C. A client with anemia asking about iron therapy. D. A client with neutropenia with a low-grade fever. Answer: B. A client with hemophilia who bumped their head. Question 31. A client receiving chemotherapy reports a sore throat and cough. What is the nurse's best response? A. Document the finding and continue monitoring. B. Encourage the client to gargle with salt water. C. Notify the healthcare provider immediately. D. Offer throat lozenges for comfort. Answer: C. Notify the healthcare provider immediately. Question 32. A nurse is caring for a client with iron overload due to repeated transfusions. What medication should the nurse anticipate? A. Ferrous sulfate. B. Vitamin B12. C. Deferoxamine. D. Erythropoietin. Answer: C. Deferoxamine. Question 33. Which symptom is most concerning in a patient with acute leukemia? A. Mild fatigue after meals. B. Frequent nosebleeds and bruising. C. Weight gain over a week. D. Loss of appetite. Answer: B. Frequent nosebleeds and bruising. Question 34. A patient with anemia becomes short of breath walking to the bathroom. What is the priority action? A. Increase dietary iron. B. Apply oxygen and call the provider. C. Assist the patient back to bed and reassess. D. Notify respiratory therapy. Answer: C. Assist the patient back to bed and reassess. Question 35. Which action should the RN take when preparing to administer a blood transfusion? A. Check the foresight for redness. B. Use a 22-gauge needle. C. Prime a line with D5W. D. Verify patient identity with another nurse. Answer: D. Verify patient identity with another nurse. Question 36. What lab result in a client with multiple myeloma needs to be reported immediately? A. Hemoglobin of 11.2 g/dl. B. Serum calcium of 12.5 milligrams per deciliter. C. WBC count of 500/mm superscript 3. D. Platelet count of 160,000/mm superscript 3. Answer: B. Serum calcium of 12.5 milligrams per deciliter. Question 37. Which task should the RN assign to an experienced LPN? A. Initiate for blood transfusion. B. Educate on signs of internal bleeding. C. Monitor a stable patient receiving oral iron. D. Evaluate effectiveness of erythropoietin therapy. Answer: C. Monitor a stable patient receiving oral iron. Question 38. Which statement by a patient with newly diagnosed hemophilia indicates a need for further teaching? A. I will avoid contact sports. B. I will brush with a soft toothbrush. C. I can take ibuprofen for pain. D. I will report unusual bruising to my provider. Answer: C. I can take ibuprofen for pain. Question 39. A client receiving a blood transfusion begins to feel anxious and develops shortness of breath. What should the nurse do first? A. Elevate the head of the bed. B. Slow the transfusion rate. C. Stop the transfusion and assess the client. D. Notify the healthcare provider. Answer: C. Stop the transfusion and assess the client. Question 40. Which symptom in a client receiving chemotherapy for lymphoma requires immediate intervention? A. Alopecia. B. Nausea after treatment. C. Oral ulcers and white patches. D. Decreased appetite. Answer: C. Oral ulcers and white patches. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.